Good morning. My name is Jerry Kohut. I am the community liaison for Cathedral Village, which is a continuing care retirement community located in Upper Roxborough. And it's really close to the Kohl's Shopping Center, if you know where that is. And it's a lovely community. It's very unique. It offers all levels of services from independent personal care, memory support, skilled nursing, and it's all under one roof, and also personal care services, which makes it nice. The resident moves in and they don't have to move out for other services. And it's a lovely building. It is just so perfect because there are trees and gardens so different than thinking about Philadelphia and what, could be a 10-story building. This is absolutely beautiful with lots of greenhouses and really nature. And a lot of the residents that move in appreciate that because it is a lot of outdoor walking and trails. So it's just a lovely community. As I said, I am the community liaison for Cathedral Village, and I do health and wellness programs for the general neighborhood. And this is my first in-person program since the pandemic. So I am just so excited to be here. I do many of them monthly for Mary Angelo, but this is the first one since the pandemic. So I am really happy to be here, mask and all. So our topic today, Alzheimer's disease. And Alzheimer's disease is something that has been near and dear to my heart. I started researching Alzheimer's in 1977. My husband and I co-authored a book titled Reality Orientation for the Elderly, because as a nurse, I would visit different places and see that the patients there with Alzheimer's disease were really just almost being warehoused. People didn't know how to talk to a person that had this disease, which is a devastating disease. So at that point, we started to think about it. And my husband and I co-authored a book, Reality Orientation for the Elderly. So that was like the springboard for my interest in not only health and wellness as a nurse, but also topics that people really didn't understand nor explore. I was given and provided with grant monies to really support Alzheimer's communities. And with that grant money, we were able not only to provide education for staff, education for families, education for the general public. So I really have been involved with the topic going back so many years. But today, as it's still here, it is still a disease with no cure. But today we're going to learn more things about Alzheimer's and the potential for some new medications. And the new medications, they are brand new. They are brand new. So I'm excited to be here, and I hope that you enjoy the session. And again, if you have any questions, it's a small group, you can just raise your hand and we'll address it at the time. And if you can't hear me, just let me know, because it's not easy to do this with a mask on. But I'm glad to be here and glad to be talking to you. Alzheimer's disease. It is the 5th leading cause of death in the United States. Let me just get this right. It is the 5th leading cause of death in the United States among those people that are 65 years and older. Direct and indirect costs of the disease, including dementia, is over $355 billion annually, including, and this includes, home care, assisted living, and skilled care. By the year 2050, the cost of the disease could rise as high as $1.1 trillion. And I always like to give those statistics. It really brings to the forefront the issues that we face with Alzheimer's disease without a cure. More data. Between 2017 and 2025, every state is expected to see at least a 14% increase in prevalence of the disease. Alzheimer's is the only disease in the 10 leading causes of death with no cure, prevention, or change in symptoms. 1 in 3 seniors will die with Alzheimer's disease or some form of dementia. So this is really, it's not a hidden disease, but a lot of people don't talk about it. They don't know about it. And also it's something that they really don't want to talk about. Mortality. People 65 and older survive an average of 4 to 8 years post-diagnosis, Yet some persons have been known to live as long as 20 years. Between 2000 and 2019, the number of deaths from Alzheimer's disease has more than doubled, with increase of over 145% because it's diagnosed. Years ago, you've heard the word senility, and that's what they thought. People that were confused and old, they were senile. You don't hear that word anymore. It is the brain with some degeneration. 1 in 3 seniors with Alzheimer's disease, almost 2/3 of Americans with Alzheimer's disease are women. More than 6.2 million Americans have Alzheimer's disease. By 2050, this number is projected to rise to nearly 13 million, barring the development of medical breakthroughs. Now, I want to make sure that you know there are some breakthroughs that I'm going to share with you, which is brand new. Every 66 seconds, someone is diagnosed with Alzheimer's disease. Worldwide, every 33 seconds. 45% of persons with Alzheimer's disease or their caregiver are told of their diagnosis. During the COVID-19 pandemic, deaths have increased 16%. So if you have Alzheimer's disease and you contract COVID-19, that increase in deaths are very significant. Alzheimer's disease is not normal aging. The greatest risk for Alzheimer's disease is old age. Majority of people over 65 years of age. It's a progressive disease which worsens with time. Life expectancy is 4 to 8 years after diagnosis or when diagnosed. There are people diagnosed with Alzheimer's disease as young as age 40. And it is a disease of older adults, but there is new information saying that there are now younger people being diagnosed with Alzheimer's disease. The symptoms. Well, you all know one of the symptoms for Alzheimer's disease is memory loss, disrupting daily life. So you can forget your car keys, but you find them and you know, wow, I found my car keys and I know what to do with my car keys. But with Alzheimer's disease, it's just memory loss that does disrupt daily life. Difficulty remembering new information, disorientation to time and place, mild confusion, trouble understanding visual images and relationships. That is so key, and we'll get back to that. Problems with words in writing and speaking, misplacing things, decreased or poor judgment, and that wandering pacing. A lot of Alzheimer's units have gardens that people can walk in. Why? Because they do pace. They don't know what to do. They have energy and they want to walk. So a lot of units now do have walking gardens, and so people can get out and use that pent-up energy. Now, when I talked about trouble understanding visual images and relationships, I asterisked that because when I was working, I've worked in and been directors of many Alzheimer's units throughout Pennsylvania, Maryland, and Delaware. But one of the things that really I have never forgotten, there was a young gentleman about the age of 60, developed Alzheimer's disease, and they were just devastated. The wife tried to take care of him, and she just couldn't anymore. It was just too much. She was so afraid that he would hurt himself or leave the house, even though she had all appropriate mechanisms in place. So they decided as a family that he should go to an Alzheimer's neighborhood. So they moved him into a lovely Alzheimer's unit. He seemed to be a little bit concerned, but he adjusted, and so that was so good. So the wife would visit every day about 4 o'clock. And they thought that was a good time because he's not tired. He's just starting to get that second energy. So she did that for about 2 months. And then he started to fade a little bit. So the nurse and the social worker said, why don't you try the morning? Why don't you come right after lunch? He might have more energy at that time. Wife said, that's wonderful. I'm going to do that. So she did it, and that lasted about 2 months. And again, it was working so beautifully. And they said, she complimented the nurse and the social worker. I'm so glad you gave me that suggestion One day she comes and he's sitting with a lady and they're holding hands. Well, you know what that did to her. Her heart was broken. But because she understood the disease and she understood why he was doing it and why the woman, the resident that was living there, has Alzheimer's disease too, they found solace together. So she understood it. A lot of people would not understand that, but if you know the disease, they have difficulty with relationships. So what happened? Every day she went, she would go, she would sit, the three of them would visit. Now that takes a lot of character and faith and love, but she did it. So that is such a significant part of some of the symptoms. They don't know relationships. And I think that's one of the hardest things for families to understand, because they just feel like, wow, dad didn't even know that I was there. Progression of the disease. A person with Alzheimer's does refuse to go to the doctor's office, excess or poor judgment, safety issues, falls with injuries, getting lost in the home or neighborhood, repetitive questions, angry or combative, understanding visual images. One of the things that are so significant, refuses to go to the doctor. They do. Number one, if we've had family members say, I just can't get him to the doctor or her to the doctor. And they would just say, I am not going to the doctor. I am going to refuse. And you can't drag a person. So that's a very important part. So you almost have to get around that also. And you could call the doctor by their first name. And we're going to go visit George today. You remember George, he has a nice apartment, whatever it does, or whatever you can do to get that person to the doctor's office. Because it's a huge problem. What can you do, especially if you need that appointment for perhaps change in medication? And, you can have nurse practitioners, you can have people come to you, but when it's the actual having to go out to see someone, it really becomes problematic. Now, who discovered this? Well, Dr. Alois Alzheimer's discovered it, and therefore that's the name Alzheimer's disease. He was born in 1864 and died in 1915. The first diagnosis of the disease is more than 106 years ago. 106 years ago, and we still have no cure. That is significant, and they have been trying. His patient, he was a neurologist. Her name was Augusta de Terre. Augusta de Terre came to him and said, Dr. Alzheimer's, I just feel like I have lost everything. I feel like I am lost. I feel like I don't know where I am. Many repetitive descriptions of being lost, not remembering, being forgetful, not knowing where she was. So therefore, he discovered it was the first patient that anyone really imagined could be more than just another neurological disease or a stroke. So he named it, and that's why he did. He took care of Augusta de Terre neurologically to care for her. Age-related memory loss. Some short-term memory loss may be expected with age. So I'm one of those that I could say, losing your car keys, now they even have car key finders. So we're not alone if you lost your car keys. Forgetting appointments, forgetting names, temporary brain freeze, those senior moments. So if let's say you're in the grocery store and somebody is walking towards you, and there's an advertisement on television about that too. And the person says, oh, hi, Mary, how are you? And you can see this blank face, like, I don't remember her name. It happens. These are things that just happens to your memory. It's normal, unless it's really repetitive and you feel like you're forgetting other things that just name finding. So I'm really good with a temporary brain freeze or senior moments. What is dementia? Dementia is an umbrella term associated with a decline in memory. So oftentimes you will see or hear about dementia. And you say, well, what's the difference? I know Alzheimer's, and then somebody said, oh, Mr. Smith down the street has dementia. Is it dementia or is it Alzheimer's? Dementia is a symptom. The symptom is forgetfulness, inability to remember simple things that they need to remember. So dementia is a symptom, and it can be caused by gradual loss of mental functioning, thinking, and reasoning. It does interfere with daily life, and so does Alzheimer's. So let's see what the differences are. It's caused by physical changes in the brain. Alzheimer's disease accounts for 60 to 80% of the person diagnosed with dementia. So it's high up there because those symptoms are very significant. Dementia. As a person's symptoms progress, they will avoid activities that require concentration. Persons do not understand where they are or who they are. They are disoriented to day, time, and place. Common causes of dementia. Alzheimer's disease is number one. You have dementia, which is forgetfulness. You might have the disease of Alzheimer's. Parkinson's disease. There is short-term memory with Parkinson's disease. A lot of the symptoms of Alzheimer's is also with Parkinson's disease, but Parkinson's disease has other elements, just not memory loss. Normal pressure hydrocephalus, cardiovascular accident. If you know somebody that has had a stroke, they may not be able to remember names or places or who they are, who their wife's name is or husband's name is. But again, it is not Alzheimer's disease. It was caused by the CVA. Chronic traumatic encephalopathy, head injury, examples, football. So CTE, when you see football players, when you see in the fall, those football players hitting helmet to helmet, that, and then all of a sudden, they don't feel right. All of a sudden, they get hit again, and they don't feel right. So football is one of those situations where head trauma can cause a really dramatic change in their brain focus and brain ability. Reversible dementia. Okay, you can have some forgetfulness, memory loss, but you may have been given a prescription, a new drug, and all of a sudden you think, oh, I just took that drug, or did I take that medicine? And then you realize you're looking at all of the side effects. You know, it could be some memory loss. So medication can do it, but again, it's just temporary. Emotional factors. I use this so often because if you are going through a death of a family member and you're in bereavement, wow, you can forget everything. You know, could be your husband or wife died, and you don't really, after the funeral, you don't leave the house. You don't want to leave the house. You don't want to go to your neighbor's house for tea. You don't want to do anything. You want to stay and you want to grieve. So sometimes bereavement then can cause some memory loss. Again, it's expected. It's short term. And I say with bereavement, it could be a year, it could be 2 years, but they're able to function. But it's the loss of someone. Metabolic factors, tumors, infections, or anemia. And I have infections starred because as a nurse, oftentimes on the 11 to 7 shift, you will have a person coming to the emergency room totally out of it. You know, their daughter said, I don't know, mom was fine, and all of a sudden she didn't remember anything. She doesn't remember me. She seems confused. I don't know what it is, and I don't know what to do for her. So an infection can cause that in older adults. Lo and behold, the person had a urinary tract infection, UTI. And people don't know that. All they know is they have a sick mother. She's confused. She's disheveled. That is a tremendous issue. But it's an infection, and it does affect your brain, your whole body. So it's good to know it is reversible. You have a urinary tract infection, you go to the doctors, you go to the hospital, they give you an IV, and by day 2, you're cleared up. Alzheimer's diagnosis. Generally speaking, when there are some memory issues, you go to your physician, your general practitioner. So you go and you say, I do have some issues. I just don't know if it's normal, but I'm concerned. So can you help me or guide me to what's happening? So sometimes that primary care might do a CAT scan or a PET scan, but generally speaking, if they know their patient well enough, they realize that, you know, she wouldn't just come to me and report these things unless there's something really going on. So they take a medical history. They always, whenever you have to go for any type of a neurological test or exam, bring a buddy with you, because sometimes you become so overwhelmed with all of the things that they're telling you that it's always good to bring a friend or someone. But I think having family present during this kind of a diagnosis is very helpful. You can sort of cue the person along. If there's temporary brain freeze, as you say, you could say, and who's ever doing the test will say, that's really fine. I understand that she's just forgetful on that one thing. Or they could take a mental exam, which is really the MMSE, is just an attention span, ability to count backwards and speak logically. And one of the big questions when you're having a neurological exam, the neurologist will say, how about if you just tell me about your day? That's a conversation. Most people can say, well, I wake up about 8 o'clock and I'm a real coffee drinker. So I have a cup of coffee. I sometimes watch the news. Then all of a sudden, that person telling the story is to 5 o'clock dinner. So she talked about getting up in the morning, having a cup of coffee, watching the news, and then and then I remember saying something. I don't remember what it was. And then I started dinner, and she starts to ramble because she can't get sequence of what the day is like. So that's a great tool to use. It's conversation. A person will tell you about their day. It's an easy thing. It's not threatening, but the physician can garner some information about telling me your day. You have the physical exam, the MRI, CAT scan, PET scan of the brain. These are all things that are used if there is some significant change in their capacity. So Alzheimer's diagnosis, you look for signs of stroke. We talked about that. You look for signs of Parkinson's disease or a brain tumor. You test reflexes, eye coordination, movement, and speech. Can person remember short lists of words or simple calculations? So now if you're over 65, there's generally a wellness check. If your doctor gives it, this is sort of normal. If you're over 65 and they will just do this wellness check annually. And these are the kind of questions that are on that wellness check. So most people can answer all those questions. There is no problem. But if they can't, there is significant knowledge that perhaps something is wrong. The mini mental state exam, I already mentioned that, but it is the MMSE, and it is called mini mental state exam. They will do that for further evaluation. The healthcare professional will ask a range of questions to test everyday mental skills. Remember a list of common objects, and in a few minutes, repeat the name. So you could say, umbrella, food, umbrella, a cucumber, and umbrella, cucumber, and I can't even think of one, umbrella, cucumber, and a pen. So the person's talking and talking to you. Then you have to repeat them again. Umbrella, cucumber, and a pen. Well, I couldn't get the first 3 out, but that's what I mean. They start with these little things. If you can get the 3 things out after about 3 minutes or 4 minutes, you're doing very well. Draw the face of a clock and then time specific, draw on the clock. So that person is trying to say, okay, I'd like you to draw a clock and then put the arms at 10 of 2. So the person is drawing this clock and then putting the arms at 10 of 2. She passed because she knew exactly where to go. But if somebody puts something opposite, these are all little tips that something is going on with your brain. Alzheimer's testing continued. Now there are development of basic computerized cognitive tests, new and more consistent than asking questions or demonstrating. The things I was talking about, the neurologist would ask you certain things. Now they have come up with things that can be alert to some cognitive loss, and they're doing those just by testing. They also have a depression and mood assessment, and that's very significant. If your mood assessment is you're down for no reason, a lot of people are down. They have good days, bad days, going through loss. but it should be consistent with your personality and what's happening in your life right now. Genetic testing, research has identified certain genes that, if present, increase the risk of developing the disease. These genes are the APOE, and the ADAD. Now, you don't have to worry about those ones, but there now is significant testing to see if you have that gene. It doesn't mean that you're going to get it. And I do know a person whose father died of Alzheimer's disease. And they thought he had a stroke, which he did. But prior to that, he started to have some memory loss. So they really didn't know what to do. He was treated for Alzheimer's disease. And when he died, his son was so upset for various reasons, death of his father. But then he thought, well, there now are genes that you can predict. So he lives in Oregon. His father was in Pennsylvania, directly went to Oregon, and he has been tested for Alzheimer's disease because he was so scared, because he saw what his father went through. And there was no other Alzheimer's in the family, but his dad had it. And at first they thought it was symptoms like post-stroke, but then they realized his stroke was over. There was no damage to the brain. Everything should look good. And he started to really have an Alzheimer's track. So his son was tested, and he now is providing money in Oregon to do more clinical trials and more testing. This fella worked out beautifully. He found a wonderful job in Oregon, high pay, and he's doing good work with his salary because he wants to find a cure. He's selfish. He said, I'm selfish, but I'm doing this for me, for my family, but also there's no cure yet. Now we're closer, and I will tell you about that, but they are the genes affected. Alzheimer's changes the whole brain. Two structures in the brain that are prime suspects in Alzheimer's care are the plaques and tangles in the brain. So you'll hear more about plaques and tangles. Hello. Have a seat. We're talking about Alzheimer's disease. Hi. So we're just up to Alzheimer's changes the whole brain. There are two structures in the brain that are prime suspects, again, are plaques and tangles. Deposits called amyloid plaques build up and cause nerve cell damage. The progress of nerve cell death is very slow before symptoms are even recognized. So when I said generally your estimated length of time with Alzheimer's is about 4 years to 8, but people probably have early stages of it, maybe 4 years before that. So they try to process these tangles and plaques and the amyloid in the brain. That has been definitively demonstrates that is the causative factor of Alzheimer's disease and memory loss. Now, Alzheimer's disease, level of impairment. So there's around 7 levels of impairment. As a nurse, I choose to have 3 because it makes it easier to understand. Mild impairment, memory loss, especially with recent events. We talked about that. You know, you meet somebody and you're at a wedding and you forgot their name and you did it again and you did it again. So that's very mild impairment, but you have it. It could be caused by other things, but it's something to recognize. The next one is moderate impairment. Pacing, wandering, you feel paranoid, people are looking at me, easily lost, you can become incontinent, there's anger, and there are massive behavioral changes. So from the mild impairment with memory loss, you go into moderate, which is you need some support at this point. The severe impairment, immobility, mute, inability to eat, swallow, weight loss, and bedbound. So Alzheimer's disease starts mildly with some mild confusion, some memory impairment, and it does go to the severe, which is really you need 24-hour care, and you're basically at that point, you might be bedridden, you might be able to get out of bed with help, into a chair, into a wheelchair, but it is really fast acting within 4 to 8 years. ruling out other causes. You don't want to give anyone an Alzheimer's diagnosis unless it's needed. So the doctor will rule out other causes: depression, stroke, reaction to a medication. If you're given a new medication, you pick it up at the pharmacy, and then you see a list of all of the things that could happen, all of the side effects, and you wonder, why am I even taking this little pill that has all these different things as a result of it? So it can be a reaction to a new medication. Vitamin deficiency. Vitamin D is really one of those things that you should just look up and find out, vitamin D. Do we all in this day and age drink enough milk? Do we get calcium? Do we get that vitamin D? Do we get sunshine? And this week we have not had a bit. So vitamin D deficiency is significant. An emotional disorder. Are they going through, as I mentioned earlier, bereavement? That would make you appear that you might have something going on. Isolation and that chronic traumatic encephalopathy is, again, CTE, when the football player is hit over and over again, and that is caused by this ruling out other causes. But isolation, I have an asterisk about that. During COVID, we are isolated. For months, we couldn't see anyone. For months, we weren't even able to share family celebrations, Thanksgiving, all of those things that were dear and near to our hearts. People that lived far away could not come, could not travel. Thank goodness things are opening up. But isolation is one of the things that absolutely, positively will wear on the brain. You need to be around people. Now, that's all well and good. Neighborhoods change. Your best friend, you live 2 houses down, you meet every day for coffee. That started your day. Or you had another friend that you used to walk with all the time. Every Friday afternoon, you had this date, so to speak, to walk at 10 o'clock. Neighborhoods change. You don't do it. You don't see the same people. So it's very easy to isolate yourself. And it's almost something that at certain ages, you should push yourself a little bit to get out there, come to these classes, see people. We used to have, we did have an Alzheimer's book club. And in that book club, people would all sit in a circle. Everybody was given a book, the same book. And even if they did not read a single line, because we used to have everybody try to read in a book, because reading is so important with Alzheimer's disease. I mean, you want to keep that person reading. Anyway, they would just be happy they'd read. But what were they also doing? They're seeing a person across the circle. They're seeing a person. They're seeing people. They're hearing people speak. So, some people would say, well, Mr. Brown didn't say anything. Well, he did. He may say something. But what we're looking at now, he's joining in. And for a person with Alzheimer's, to see people is significant. So there's so many things, but I think isolation is very conducive to lots of problems. I talked about chronic encephalopathy, a brain condition associated with repeated blows to the head, the symptoms of CTE, problems with thinking and memory, personality changes and behavioral changes, aggression, depression, and suicidal. Now, you've seen or heard over the television, many football players, after the fact, they did an autopsy and found out this person's brain is significantly damaged as a result of so many hits during playing football. So CTE is extremely important, extremely significant. And actually the physician that really not discovered, but had many physicians at meetings talk about CTE, because he practiced in Pittsburgh and University of Pittsburgh Pirates, right? He would see not a lot of people, but some of the players come in and complain about memory loss or complain about something doesn't seem right. And he started to think about these blows to the head. This CTE is not new, but it's now recognized. So that's why they say they have all these special helmets that they wear. Well, a special helmet and a blow to the head. I don't know if that really corrects it, but CTE is very significant. And look at all these different things. And you know that people, especially football players, have had depression, and some suicidal ideation. Alzheimer's warning signs. So we talked about some things, but memory changes that disrupt daily life. So if you get up in the morning and you think it's dinner time, that disrupts daily life. Challenges in problem solving and planning, difficulty in completing tasks at home, work, or leisure. You start one thing and then, oh, well, I'm going to go to the second thing. By the end of the day, you have 5 projects started, and it's an early warning sign. Confusion with time or place, trouble understanding visual images and special relationships, problems with words or in speaking or writing. Letter writing is just so wonderful. People don't write letters anymore, but it's a good thing to keep your brain active. You're sitting down, you're writing a note to a friend that you haven't seen for a while. You could pick up the phone, but a letter is so meaningful because people don't write letters anymore. They may send a text for happy birthday, those kinds of things. But we have to get back to some of the things that were very common to us because they actually helped our brain. Warning signs: continued misplacing things with inability to retrace steps, decreased or poor judgment, withdrawal. People with early stage Alzheimer's, they do withdraw. They don't want people to think, wow, what's wrong with her today? She doesn't seem like herself. And she didn't even dress right. You know, she didn't look, she looked disheveled. So these are some of those warning signs. And withdrawal is one of them. Changes in mood or personality, reminders needed for personal care, telephone use, and preparing meals. So a person with Alzheimer's can, in early stage, can do these things, but they need some cueing and reminders. Aging health issues along with Alzheimer's disease. Well, you have the disease and you're 70 years old. But guess what? You also could have another illness. You could have an acute illness. You could have pneumonia. You have a high fever, your chest hurts, you go to the hospital. So you have Alzheimer's disease and you also have pneumonia. Pain. Pain is just horrible because they cannot explain what the pain is. They're just upset. They're twitching, they're moving around, they can't sit still. And you have to be like their brain to think, why is that person doing that? It could be due to pain. Vision and hearing impairment. Just think, imagine if you had Alzheimer's and you lost your glasses. Well, we all have glasses on. I have glasses in my purse. That's really significant. You get up in the morning, you put those glasses on. So vision and hearing impairment is significant that's an aging health issue along with Alzheimer's. Adverse medication effects, we've discussed that. Environmental issues. A person with Alzheimer's needs a quiet environment, not over or under stimulation. Temperature, hot or cold. It's got to be even. Everything that you do with a person who has Alzheimer's is even keel. Nothing is too much or too little. Too much noise or distraction. Caregiver response to behaviors and quality of life issues. I already mentioned about the caregiver. That person really has to know what Alzheimer's is and how it has affected their loved one, so they have a better understanding of what may happen. Social issues. When already experiencing confusion, they can also be experiencing, they may also be experiencing grief or anger, family interaction, patient aware of changes. So these things occur while you're experiencing confusion. That's significant in itself. You can be going through a period of grief, but you have Alzheimer's and you have other issues along with that. Emotional issues: depression, sadness, fear, loneliness, and worthlessness. These are all issues that we all have at some point in time, but when you have them on top of Alzheimer's, it is more challenging to manage. Treatment modalities. Well, pharmacological treatment. Current drugs do not cure nor stop the progression, but may lessen symptoms for limited time. The drugs are Aricept, Exelon, Razodine. They're the 3. Those drugs are as old as 1980, And they do help. They may lessen symptoms. People can be on those drugs for years. Family members really feel that they see a change in their mother. They see a change in their husband. They often will say, once Aricept, Exelon, Razodine, we generally say 6 months to a year. That's about their length of treatment. That's about, after that, nothing else is going to change. Statistics say that, but family members say, please keep my mom on it because she seems so much better. Now, if you keep the person on it, it's not going to hurt them, but it has a length of time. It will significantly change some, occasionally, some issues with Alzheimer's. The moderate to severe disease, they use Namenda, which it can be either extended release capsule or syrup. So the moderate to severe, perhaps they can't swallow anymore, but they can manage syrup or the release capsule. So they are some things that they're tried and true. They don't cure, but we're going to talk about that later. Non-pharmacological treatment, music, reading, and I highlighted because when we move in a person that has Alzheimer's to an Alzheimer's unit, my recommendation is always like the second or third day. See if that person can read. You can ask the family member and they'll say, well, I don't think so. I mean, never reads the paper, but reading is so significant. If they still can read, they can read a book. They can read something. Their brain will function. And we used to, after the third day of admission, you sit down, and what I used to do and teach people to do it, you could sit down next to a person that is in the Alzheimer's unit, and you could say, what I'm trying to do is create, I have to create a poster, and I don't know how big these letters should be. So I'm going to test you. If you can read it, that means that's a good poster. So you start with a real small B, and you would say, can you read that? And shake, because there's some understanding there. No. So you get a little bit bigger. Then can you read this big B? Yes. And then you print in the word E, big letters, just like the B. Then you scroll the letter S, big letters, just like the B-E-S. Then you do the T, B-E-S-T. Wow, that's great. Can you read this? If he says best, he or she says best, you've got them. You enroll him in the next day reading class. Reading is so significant because if you don't do that, they can lose it. So reading is so significant. And that's how we used to do, to try to get a person to continue. Walking, well, they love to walk. They like to wander. A lot of Alzheimer's units have a wonderful neighborhood, and then they have a walking path specifically for the persons that have Alzheimer's. So walking is wonderful. Sharing old photos, reminiscent therapy is so wonderful. All of these things are special because they keep the person involved and engaged. Now, there is new Alzheimer's drug under FDA review. FDA is studying new drugs based on an analysis of clinical trials and panel review. Aducanumab sticks to the amyloid molecule, which forms plaques in the brains of people with Alzheimer's disease. The body immune system reacts to the aducanum and removes the plaque. Once the plaque is removed, brain cells will stop dying and function behavior can return to normal. This is hot off the press. I mean, I probably give this presentation maybe every other month. People want it. I have a list of things that I do, but so I always update it as I, make sure that everything's correct and accurate. This is so new. As I was looking at it, I thought, oh my God, it's the first time new Alzheimer's drug. So we're waiting. It's under FDA approval, but it looks like it's going to help. So I wanted to share that with you. And you could just, if you go online, you'll see other drugs that are coming out that are new. So there still is not a cure. But if this drug's works, the person can return to normal. That's big. And I chose that drug because that was the drug that said the person, if they're taking this, the plaque is removed from the brain cell. That's what stops the amyloid, which needs, the amyloid and the neuron need to connect. With Alzheimer's, they don't connect. The amyloid eats that nerve cell, so to speak. So it is absolutely wonderful good news. Other new developing treatments, they're developing strategies to help mild Alzheimer's disease patients to remember things a little bit better. So what they're doing is saying, well, if they can't remember their name, maybe they have to do something like a poster saying your name, typing it in your name or printing your name, anything that will help them in remembering. The study of nitric oxide, a gas that has critical functions to brain health. And that was new. They're trying new things because they know that they don't have that cure yet, but they're getting so much closer this last few years. Drugs that remove the TAW, the tangles in the brain of patient with Alzheimer's disease. So we started with removing the amyloid plaques. Now they also can do something with the TAW to, again, help to remove some of those receptors that are blocked through Alzheimer's disease. Now, I just love this. We still have a few minutes. Montessori method. Maria Montessori worked with children in Italy in the 20th century, designing educational activities based on their ability. Today, this concept has been adopted for some Alzheimer's patients. Remember, we're looking at designing educational activities based on their ability. We already talked about that. If you know a person can read, you keep them reading. Promote independence in daily living and positive engagement. Activity using Montessori is broken down into steps. The goal is engagement and stimulation. We don't care what the finished product is, but the person is engaged. You always, when you're doing a Montessori method, you invite the person to sit down with you, number one. You sit in that small circle. Remember I talked about the reading program? You sit in a small circle. You sort of talk, but you demonstrate more than talking. People with Alzheimer's understand that. So if you're going to paint something and big poster board, and you start painting, large print or whatever, you demonstrate. And you work from simple to complex areas. Ask clients, did you enjoy the session? Would you like to do this again? You're inviting people. You're not saying, come on, Mary, we have to go to this program. You're inviting, would you like to come? If they say no, not today, or if they just say no, you work your way to getting that person in this group. It absolutely works wonderfully. Okay, now let's decrease your risk of Alzheimer's. Smoking cessation. Got to stop smoking. Weight management. Maintain cholesterol and blood pressure. Physical activity is so key. Socialization, I think out of all of these, we'll talk about that. Socialization, a good night's sleep, and that is so significant, and healthy aging. But if I listed these, I say socialization is the best vitamin. Helpful tips when supporting a person with Alzheimer's. You always talk to a person, if you know somebody that has it, in a calm, slow voice. You always call the person by name. Well, hi, Jackie, how are you doing? Excuse me. Use short sentences, give one instruction at a time, speak slowly and clearly, and always be respectful. Approach person from the front. If you approach somebody that has Alzheimer's disease from the side, they're going to scare them. So you always go front first. Use gentle touch as tolerated. If you just hold somebody's hand, then that person might be fearful. You just say, Mary, can I hold your hand? And take it from there. Reduce clutter and always have a safe environment. Brain health. The brain continues to develop and can be shaped by the environment. The brain can generate new cells throughout life. We love that. Lifetime of brain health, socialization, physical activity, mental stimulation, lifelong learning, develop hobbies and talents. You have to be active. Alzheimer's support. Persons with Alzheimer's disease absolutely need support. Caregivers and family need support. Alzheimer's support groups help in supporting family. So if you have a family member that has Alzheimer's, there are Alzheimer's support groups throughout the city, throughout the state, and they are just wonderful. Alzheimer's Association, always, alz.org. Remember that, alz.org. You can get so much information. They actually give you a brain tour. Takes about a half hour perhaps, and you see the brain at different stages of life, but you learn so much from Alzheimers.org. They also have support group listings. If you have a family member that has it and you want to find a support group, and they have a 24-hour hotline, and you can call it 24 hours. You might have a family member that has it and finally went to sleep, and you call 3 o'clock in the morning, they will answer that call. They won't call you back. They will answer that call. The phones are manned 24 hours. So, do you have any questions? I'm trying to get out of this. Any questions about Alzheimer's or what I said today? Well, I think Alzheimer's, it is a disease. Remember, when you leave, there is something, we've never been that close. For years, we've never been this close. And all of a sudden, so these people have been working their clinical trials. First of all, clinical trials. It takes perhaps 4 clinical trials to get through if the medication is safe. And they start with the first clinical trial, which would be they have about 20 people in that first clinical trial. We're saying, is this drug safe? Well, they already think it's safe, but they have a trial on 20 people. The next phase, they have, it's phase 2, and they have a few more people involved. And maybe that would be 100 people. Say the third stage, they might have 500 people. You need a lot of people to be given this medication to show that it's safe. The fourth phase, they can have 10,000 people. So what I'm saying, these clinical trials have to be provided. But the catch here, there are not an awful lot of Alzheimer's disease people. Actually, it's 4 years. The clinical trials, they try to keep you on the disease, on the medication for at least 2 years. So if the person started with this clinical trial, they may die before it ends. So that's been the problem with clinical trials. But I would say they are so far ahead than they ever have been in testing medications that can work for Alzheimer's disease. So they are doing it, and they're doing it right, but they just need a group of people. And that's why my friend's son, he is in a clinical trial. But there's so many more people that we need for these clinical trials. And if you have Alzheimer's, and that's what they need, these medications, you take them so that we could decide whether or not it's working. And sometimes they just don't have the time. Anything else I can share with you? I will tell you one thing. Go to Penn Memory Center. This Penn Neuroscience Center in Philadelphia, connected with University of Pennsylvania. They have a building, Penn Memory Center, and it is just wonderful. There's about 5 doctors that are in that center just for Alzheimer's disease. I just think it's wonderful. One of the doctors that I know very well is Dr. Jason Karlowich, and he just wrote a new book about the best thing that you can do is conversation with a person with Alzheimer's. That's what you need to do, converse with them. Don't be afraid of that person. Just have a good conversation. So it is the Penn Memory Center. So I'll be back here May 20th, same time, same place, 11 o'clock. And I'm going to do a presentation on opioid crisis and COVID-19. May 20th, I will return. And I hope you return also.